In our Health Edge now, taking antibiotics at an early age may increase the odds for allergies later in life.
Our chief health editor, Dr. Nandi, is here to break it down for us.
I like this study. You know, this new study actually suggests giving young kids antibiotics may increase their odds of things like hay fever and eczema later in life.
Okay, how are they connected to antibiotics? What do they think
That's a
happens
good question.
here?
So scientists think, this is in the Netherlands, so it applies to us as well, took a look at 44 studies with over 650,000 patients. They found kids who were given antibiotics under the age of 2 had an increased risk of developing allergy as they get older. They had an up to 41% increased chance of developing eczema and also up to a 56% increased risk of developing hay fever. So important points there.
Now, eczema and hay fever, kind of different things. What are they and how are they linked?
Exactly. So if you've had any kids with that, so eczema is a chronic red itchy skin condition that can flare up periodically. I know because one of my kids has it. And then hay fever is also known as allergic rhinitis and gives you cold-like symptoms that are caused by an allergic response to things like tree and ragweed pollen, dust mites, or animals such as cats and dogs.
You always have a prescription for us, we know that.
Today
so
is
what
no
is it?
exception. So, you know, I talk a lot about antibiotics, and I think we really need to be educated about them. So here are my prescriptions. First of all, don't avoid giving antibiotics to people who really need it, especially children. Bacterial infections need to be treated. People die from meningitis and pneumonia. Number 2, however, don't ask for antibiotics when your child has a cold. They're not effective against viral infections, especially don't force your doctor to make that choice. 3, it's important to get vaccines and immunizations. They're an effective way to prevent the infections that may actually require an antibiotic. Also, never skip doses or stop taking an antibiotic when prescribed. They're likely to do more harm if you're not taking them correctly, and we all know that.
So are the antibiotics themselves causing this link to allergies, or is it like triggering something?
That's a good question. So researchers don't know if the allergic disease causes more infections that need more antibiotics, or if the antibiotics influence the development of them. So more research is needed. It's almost like chicken and egg.
Yeah,
you know.
right. Eventually we'll know, right? Thank you, Dr. Nandi.
You're my
Good stuff.
pleasure.